Hi class, today we're going to be discussing anxiety disorders. So in class we've been going over the different types of anxiety disorders, and so I thought I would focus here on instead about the prevalence of anxiety, specifically with the gender and ethnic/racial differences are, and what may cause those differences. Then I want to do a brief overview of some of the biopsychosocial causes of anxiety, as well as go into a little bit more about treatments. So hopefully this is a good supplement to our in-class activities that we have going on and other things. So this slide should look pretty familiar to you. This is a slide that was presented in class. But again, it's just to remind us that there are different types of anxiety disorders, and you should know what the key symptoms are. So what makes specific phobia different from agoraphobia? What makes social anxiety disorder different from generalized anxiety disorder? And just to kind of round this out, we used to think that PTSD was similar to anxiety disorders as well as obsessive compulsive disorder. And I just want you to keep that in mind, that you might see some similarities here in things like treatment, things like how we kind of conceptualize or think about these different disorders. This should also be a familiar slide to you. So with the past year prevalence of any anxiety disorder, I know it's a bit older of data, and unfortunately it's because I can't find a more recent one, but you see that we have 19% of Americans that are living with an anxiety disorder, and more of them are female compared to males. So I thought it would be good to get into, well, why? The diagnosis of anxiety disorders are almost twice as high for women compared to men. I hope you've noticed that this is also the same thing when it comes to depression and PTSD. So we're going to see a higher prevalence of these kind of anxiety, or what we like to call it is internalizing disorders for women compared to men. And unfortunately, this tends to be more disabling as well. So you see higher comorbidity in women for depression and eating disorders. Again, that might be due to the fact that depression and eating disorders are also more common in women compared to men. This also relates to more doctor's visits and more missed days of work for women. So it really is more of that dysfunction that's happening, maybe higher levels of distress as well for women compared to men. So ask yourself, why might that be happening? What are some thoughts that you've had? And we've seen lots of different explanations. So this is just a slide to show you all the different types of explanations. We'll get into a couple of them, but one of the things is our personality. So we're going to talk about this a little bit later when we get into the biopsychosocial, but neuroticism is a personality trait where you have higher levels of negative emotions, are a little bit more emotionally unstable, and it seems to be highly heritable in women. We also know that there are hormonal fluctuations, so things like pregnancy. Pregnancy can be related to women having lots of hormonal changes, and there may be an increased chance of having anxiety during or after a pregnancy. So you'll have things like more anxiety disorders, postpartum anxiety or postpartum OCD. So yeah, the pregnancy seems to do a lot for those hormonal fluctuations. We also have a lot of gender socialization here. So how we're raised, and this might be specific to specific cultures, but here in the U.S., for example, women are kind of taught to avoid things that are fearful rather than approach them. Whereas men are kind of told, do this head on, and you should approach the things you fear. Psychologically, we have higher levels of trait anxiety, higher levels of negative affectivity. Again, that might be that neuroticism here. And something that we call anxiety sensitivity. So fear of anxiety and anxiety-related sensations. So a person I know was saying that they are fearful of exercising because that mimics the feeling of your heart rate going up, shortness of breath, and all of those things might feel like a panic attack is coming on. So that anxiety sensitivity may lead them to change their behaviors and not do as much physical activity. Stressors also are a big part of this. Women are more likely to experience stressors and trauma. We found that out in our PTSD lectures as well. And I'm going to talk about two things here, which is a cognitive appraisal and coping strategies. So cognitive appraisal of stressors is basically how we think about our stressors. So we have some sort of event that happens. Let's just say that this is the event of having to give a speech in class. So our primary appraisal is our first thoughts about that. So if I say, oh, this is really threatening, I'm, gonna puke all over myself, right? We see this as a threat. Then we go into the secondary appraisal. Well, can I actually cope with this? And sometimes, you're like, yeah, I can definitely cope with this. And if they are adequate, then you don't have any stress. So if you're like, well, I've done this in the past and it seems like, yeah, I might be nervous to do that speech, but I've gotten through it before and it worked out just fine. I'm not going to experience any stress. However, if maybe you've had a lot of stressors in your life, you're already kind of tired and have a hard time with coping with things right now, you might experience more stress. So it's kind of going through these thought processes of, is this actually a threatening event? And secondly, can I cope with it? So women are more likely to perceive them as threatening, as well as less likely to think their coping resources are available to them compared to men. So another thing that could be happening here with the gender differences and anxiety is the type of coping that we use. Men are more likely to use problem-focused coping compared to emotion-focused coping. So typically we can kind of think, is there a problem that's going on in my life? Let's say it is that problem of doing a speech in class. So yeah, there's a problem. Can I change it? Well, a man might be more likely to go down to a yes. Yeah, I can change this. So maybe I can, start on my, presentation slides earlier compared to later. So is now a good time to work on this? Yes, that is problem-focused coping. If, on the other hand, you say, no, I can't change this whatsoever, you may experience more emotion-focused coping. So you're focusing on the changing your emotions, or maybe also doing things like rumination. We talked about that when we talked about depression, is that sometimes you are just focused on those emotions that you're experiencing. And women are more likely to use this emotion-focused coping compared to men, which might use more problem-focused coping. I always talked about this with my husband, the engineer. It's just like, let's get down to it. Let's figure out how we actually can solve this problem. And I might be more distressed about it and go like, I don't know what to do. So, focusing on those feelings instead of focusing on how do I solve this problem? What are the steps I can take? I'm going to stop it right here. And when we come back, we'll talk a little bit more about racial and ethnic differences in anxiety.